Research conducted by international NGO PATH has found that high public debt and low tax revenues limit the fiscal space for health and immunization. This emerged at the 15th Network of African Parliamentary Committees on Health, and that conference was attended by representatives from 25 African states and partners. PATH's advocacy manager, Esther Nasikye, joins me and we'll talk more about their findings. But Esther, I also want to bring in a little bit more context into all of this, and it's quite important context. Immunization against major diseases in childhood, is part of the foundation of social health care around the world, and from what we understand, averts around 4 million deaths annually, also saving the healthcare system the burden of, diseases later on in life. 1 in 5 children don't receive all of their basic vaccines in the African continent. 30 million of them are still suffering from vaccine-preventable diseases. So expanding access to immunity or immunizations is an important point. And I'd love for you to pick up the conversation from that context, please.
Thank you so much, Imani, for having me. And the background you've provided is exactly right. Just thinking about the fact that countries need to finance their immunization programs better. But on the African continent, we see a lot of dependence on donors like Gavi. And in terms of what countries are exactly investing in their immunization programs is really very low. And this is coming from having very low tax revenue. So how much a country is collecting from their taxes, from their internal revenue collections is not much. So also what they are able to allocate to immunization programs is very little. And that is what is translating into, vaccine stockouts in some communities. And because of that, children are not being vaccinated. We call them zero-dose children. Children are not being vaccinated well enough. Africa has the biggest contributors of zero-dose children in the world. And the 2 countries that are the biggest contributors are Nigeria, that has a population of more than 200 million people, and Ethiopia. They are the biggest contributors. But also other countries do have their percentages of zero-dose children. And it's because we don't see enough access to vaccines. We also don't see, the human resource that is needed to deliver vaccines where they are needed. But then also, even within the communities, we see a lot of hesitancy. But the COVID pandemic reminded us that everybody needs to remember that we need vaccines to be safe, to prevent pandemics, but also in terms of response to pandemics. So it's not only children we are talking about here. Even the adults are now clients of immunization programs. But the question is, are we as African countries able to finance our immunization programs? It's still a big question. So
we'll circle back to the question, Esther. Sorry, let me just follow on from what you've picked out. Just in terms of access to vaccinations. When you talk about countries leading the pack on the African continent in terms of zero dose, it's curious to see Nigeria, which is one of the biggest GDP countries on the African continent. Those 2 stories and 2 realities don't talk to each other. Just go deeper as to why there is that hesitance, or why we're sitting with this number in the Nigerian experience as a major economy on the African continent.
Thank you. So I'll first talk about the economics of it all, that Nigeria at the moment, a country with the biggest GDP, like you've said, is only able to cover up to 50% of their immunization budget. The other 50% is covered by donors. But then bringing it down, it's also because Nigeria only collects up to about 10% of their taxes in, their GDP in relation to the taxes that they're supposed to be collecting. So there is a challenge there that they are not collecting enough in terms of taxes, and then they are also not able to finance in health programs, including immunization programs. They can only do the 50%. So that means there are pockets of Nigerian children and adults somewhere that are not able to access the life-saving vaccines that we are talking about because they are not procuring enough. And also the program is not able to manage, the supply chain adequately to ensure that the far-to-reach areas are reached with these critical vaccines. The far-to-reach areas are reached with these critical vaccines. So that's why we see bringing the rise to zero-dose children. But then there are also issues around hesitancy. People that just do not believe in vaccines as a life-saving commodity, whether because of their religion, whether because of their culture, or the belief that this is a white man's solution to wipe out the human race. We've seen all those conspiracy theories on the continent, including in countries that we are talking about this, today. And so that has increased the hesitancy and, limited access to vaccines.
Well, let's pick up on that thread, because one of the pieces of work that you do is advocacy for immunization. You've talked now about communities who are resistant. How do you couch it for some who say immunization isn't good and, in fact, will lead to adverse health outcomes for our children? How do you get them out of that perspective or that belief?
I'll mention two ways that we need that we address that. One is for every country to ensure that they have a very strong policy framework that can respond to issues, around hesitancy and all that. There should be a policy that says it is illegal if you are not taking your child maybe for vaccination. There should be that. But then the other bit is working with the champions within the communities, the faith leaders, the cultural leaders, because we are still a continent that is very much entrenched in, our cultural values. So there are cultural leaders that are listened to, that are respected in the communities. Can we work with them as champions, of behavior change in the communities, to talk to the parents, to talk to the caregivers, to ensure that they are accessing the life-saving commodities. But then also the parliaments, making sure that the resources are available to drive service delivery to the last mile is important.
So there are threats to funding immunization programs, and part of it relates, and you've touched a little bit on this already, to governments who don't see it as a very high priority. Why should it be a high priority?
Well, first of all, I know governments do see it as a priority, but the resource constraints are real, that if you have a small budget because your tax base is really very low, you may not have much to allocate. So that is one thing that I could say. But then also we need to think about, the alternative sources of funding, because immunization is the biggest public health intervention, that we know. We also have been reminded by the COVID pandemic that immunization prevents pandemics, or is one of the response measures to pandemics. So if we don't want to see a measles outbreak in the continent, we don't want to see yellow fever or another COVID pandemic, then we need to invest more in vaccines, making sure that they are available, because it makes economic sense, but also it makes moral sense. Every dollar that is invested in immunization, it has been proved to save more than $16, for every person that has been vaccinated, because it means you will not spend more money in the hospitals because of vaccine-preventable diseases. You will also not spend more time off work because you have measles or you have malaria. Now we have a malaria vaccine on the continent. So it saves lives, it saves money, and it saves time. It makes economic sense, but also moral sense.
Given, as you say, then, let's go back to the finance question. The governments are constrained if they're working off a low tax base and there isn't a co-payment or co-sponsorship for immunization programs, that you're going to see a very low uptake or, a higher incidence of zero doses in those communities and in those countries. What are some of the quick wins and some of the easiest ways that the continent can really get around this? Because as you've said, and as conventional wisdom dictates, that if you don't take care of these the potential for these diseases now, when they emerge later, the burden on the healthcare system becomes exponential.
Yes, so first of all, I think for every government to take advantage of the arrangement that Gavi has for these countries, to say you still have a period of time to work around your financing for vaccines. So we are not asking governments to transition and fund fully, but we say you need to fund incrementally. Let there be that commitment to say, this financial year we've allocated this amount of money to immunization. Next financial year we need to increase it to this amount to meet, the cost of new vaccine introductions and so forth. We need to see that commitment coming through. But then the other bit is governments on the African continent need to work together and come out, and bring the idea of vaccine manufacturing in the region to reality, because all the vaccines are being imported from somewhere. That means that increases the cost of importation, the cost of, management. So by the time it reaches the facility in a rural community, it means you have invested a lot of money. So we need to think about manufacturing vaccines on the African continent. that is going to be one of the solutions for us to address the challenges that we are facing at the moment.
And that point on being structurally ready from a manufacturing perspective to deal with outbreaks of pandemics and epidemics really clearly and eloquently in an insidious way, I suppose, through the COVID-19 pandemic, the need for us to make and be able to distribute our own vaccines on the continent. Thank you for your time, Esther. We appreciate it. Esther Nasikye is from PATH, talking about the need to ensure that funding continues to be available for immunization programs across the African continent.